to bring to the Power Rising stage the chair of the Congressional Black Caucus, our sister, Congresswoman Yvette Clarke. Let's clap our hands. And y'all, she's my line sister. I love her.
That's all I get. That's all I get. Come on, y'all. Boost the sister up. This is Power Rising. What's happening in here? What is happening in here? Oh, I'm feeling the energy now. I'm feeling the energy now. Greetings and good morning, everyone. I am Congresswoman Yvette Clarke, chair of the Congressional Black Caucus for the 119th session of Congress, and very proud representative of New York's 9th Congressional District, located in Central and Southwest Brooklyn. Brooklyn in the house, always, always. I am so grateful and privileged to be with our nation's greatest leadership, visionaries, advocates, and activators in the Windy City this weekend for Power Rising 2026. I remember when Power Rising began. I was here at the inauguration alongside my colleague, Congresswoman Robin Kelly, and Congresswoman Bonnie Watson Coleman. We started the caucus on Black women and girls on Capitol Hill that year. So it's great to see how the growth and development continues among Black women in Power Rising. Let me welcome you to the State of Black Women's Health, a vital panel discussion that has assembled together leading voices across healthcare, policy, and culture to unpack the full landscape of Black women's health, from mental and emotional wellness to reproductive justice, chronic disease, and the social determinants that shape outcomes each and every day. It is tireless work, lifetimes of lived experiences, and uninterrupted devotion to the cause of Black women's health that brought these remarkable women to us today. So let's give them a very strong welcome and round of applause. I'm very eager to hear the insights they have in store for us ahead. I would be remiss, however, if I did not acknowledge that in the room is another New Yorker. She's a member of our delegation, and she serves on the Committee of Jurisdiction for Healthcare alongside myself and Congresswoman Kelly, and that's none other than AOC, y'all. AOC in the house. So let me begin by just hailing our moderator this morning, the Reverend Shavon Arline-Bradley. Hello? This sister is super bad. You know, the sisters that are here, they wear so many hats, it's crazy, crazy. But the Reverend Arline-Bradley serves as the President and Chief Executive Officer of the National Council of Negro Women. NCNW in the house. I see some purple power up in here. Bringing more than 2 decades of dynamic leadership and expertise across the fields of healthcare, diversity, equity and inclusion, government affairs, and strategic and executive strategy. I also want to give and acknowledge our Emmy-nominated television host, lawyer, author, and longtime advocate for women's empowerment, none other than Star Jones, y'all. She is also a foundational leader when it comes to Power Rising. We love you, Star, and thank you so much for being with us all the way through this journey. You could be doing a whole lot more, but you did not see it robbery to be in the midst and giving us the type of encouragement and support. Just hearing your story helps us to put you in the spaces that we can reflect on and be empowered by. So thank you so very much. I want to also since I'm in Illinois, give a big shout out to my sister from another mister. She is my Thelma and Louise or Set It Off, whatever you want to call it. That's my sister right there. Congresswoman Robin Kelly of Illinois' 2nd Congressional District. And I would be remiss if I continued without shouting out, of course, the sorors on the stage, Reverend Arline-Bradley and Miss Lockley. We are all members of, come on, y'all, Delta Sigma Theta Sorority Incorporated. I have to say it, because Leah Daughtry's sister, who was like scoping her out this morning, Dornique, is my line sister, everybody. That's right, we crossed the burning sands together. So let me just say that our president, our international president, is in the room, and I want to make sure that I acknowledge our international president, Cheryl Turner. And let me acknowledge Leah Daughtry. You know, we were raised together in Brooklyn, so, you know, it's family, extended family, and it's always an honor. Let me thank each and every one of you sisters. You are here today at the call, and you answered it. And our power continues to rise because you show up. As the young people say, you outside. And being outside gives you a unique advantage in terms of the ability to sort of move in and out of and interwoven into the lives of so many of our people who are struggling. What often happens, though, is that we are giving so much to so many, we don't even think about our own health. We're caregivers, we are advocates, we are out there, we are energized, and in the midst, we miss that appointment. We don't even make the appointment. We're coughing and we think we'll just get through with a little Robitussin. Our abdomen is burning, but we missed that appointment. And so today's conversation is so critical because self-care at the end of the day is so critical to the work that we do, to the life-saving work that we do. While today is a cause for celebration because we're bringing each other together, we must not forget that yesterday marked the end of the 10th annual Black Maternal Health Week, a somber but necessary opportunity to confront inequities in maternal care and end our nation's maternal health crisis. Because I am certain, you know, Black women are 2 to 3 more times likely to die from pregnancy-related causes than white women. And the tragic fact of the matter is that 80% of these deaths are preventable. We have a responsibility to listen to Black mothers and make sure that pregnancy is a time of joy for every family in America. And that's why we support the landmark legislative solution to stop this crisis and make Black lives the priority they must be, from another champion of the people of Illinois, and that is the Momnibus Act, introduced by Congresswoman Lauren Underwood. The Momnibus is designed to end preventable maternal death in America by closing the growing health gap for Black mothers, growing the prenatal health workforce, expanding access to maternal mental health and substance use care, and lowering health care costs, closing research gaps, and improving data collection and providing direct federal funding for local community-based organizations that improve maternal health. Ladies, it's past time for the Momnibus to become law. I can tell you that when Congresswoman Kelly came to Washington, she came as an earthquake around maternal health. as chair of our CBC Health Brain Trust. And we're continuing to build on the legacy of focus on maternal health care. And that really extends to reproductive health. And there's a lot of work, because as a co-chair of the Black Women and Girls Caucus, just like my fellow co-chair, Congresswoman Kelly, will later tell you, a huge part of my work is ensuring that Black women's health needs are heard, addressed, and not ignored. We are tired of Black women having to deal with an unacceptable status quo and receiving minimal care in the name of continuing it. And that's why a particular point of pride in my work this Congress is my introduction of the landmark uterine health legislative package, which encompasses the Uterine Fibroid Intervention and Gynecological Health Treatment Act, UFIGHT, the Uterine Cancer Study Act, and the Uterine Fibroids Awareness Month resolution. And lastly, a bill of personal significance to me. That is the Stephanie Tubbs Jones Uterine Fibroid Research and Education Act. And this legislation was named for my late dear friend and former colleague, Congresswoman Stephanie Tubbs Jones, who fought every single day to deliver the critical attention and funding this issue deserves. As we are all aware, uterine fibroids are non-cancerous growths on the uterus and in the uterus. But did you know they are among the most common gynecological condition in the United States of America? Living through my own challenges with uterine fibroids, I invariably think of the millions of marginalized women who possess little to no means for treatment and can access no solutions to their pain and suffering in silence. Today, approximately 26 million women and girls in the United States between the ages of 15 and 50 suffer from uterine fibroids, with more than 15 million experiencing what is classified as severe symptoms. Of the 26 million, no group is more adversely impacted by uterine fibroids than Black women, who are twice as likely to develop fibroids as Hispanic women and up to 4 times more likely than white women. Black women get them at a younger age, deal with more and larger tumors, and experience harsher symptoms. That's why I've introduced the Stephanie Jones Uterine Fibroid Research Act. Not because I believe our country should dedicate adequate resources towards uterine fibroids and research, as they should, but because I know it is essential that we do. We cannot, in good conscience, continue to ignore the millions of women and girls who suffer from an illness and debilitating as pervasive as uterine fibroids. Congresswoman Tubbs Jones first introduced this bill more than 20 years ago, y'all. 20 years. So we need to get angry. We need to activate. We need to put the pressure where it belongs. The CDC, the NIH, all of these federal agencies need to be doing the work so that we don't have to go through these conditions unabated. So let that resonate with you. And there are few diseases in America are so radically underfunded relative to the burden and pain they inflict, and that's one of them. With my bill, we're going to change that. We're going to establish new research funding through NIH at $150 million over 5 years. We're going to expand the CMS database on chronic conditions to include information on services provided to women and girls with fibroids. And we're going to create a public education program through the CDC. We're going to direct the Health Resources and Services Administration to develop and disseminate updated and comprehensive uterine fibroids information to healthcare providers. Far too many women suffer from fibroids because they don't understand that their symptoms are ununiform, or uninformed, that these symptoms are due to fibroids or complications associated with fibroids. So this legislative package as a whole is aimed at advancing uterine health initiatives, funding, and research for ovulating people, menstruating people, but especially for our Black people who are impacted by these conditions at a devastatingly disproportionate level. So we can't let them down, y'all. We gotta do this work. At this dangerous time in our society where disinformation finds its way within our communities from the highest levels of this country, and pseudoscience has more prominent podium than ours, it is critical that we get the word out. So let's be clear, Black women's health is a public health crisis, is in a public health crisis, and it's only growing more dire. So let us continue the work to build a nation that acts and sees us in the center of the work that needs to be done. When workspaces force Black sisters to conceal themselves, we have work to do. So, sisters, let me thank you for, again, taking the time from your busy schedules. I know it's always wonderful when we come together. We feel the vibe and the energy from one another, and it's almost like being in a spa, ain't it, y'all? You get that woosah moment, but make sure you continue to get that woosah moment. And these women on today's panel will help you and guide you to finding that space where your health, as they say, the first law of nature. What's the first law of nature? Self-preservation. Hello? Hello? Put your mask on first before you go to help other people. God bless you. God keep you. God strengthen you. And I now turn it over to our moderator, Soror Shavon Arline-Bradley.
All right, all right, all right. Let's hear for the Congresswoman.
Good morning. Thank you.
All right, my sisters, just wave your hands in the air. Just stretch out, stretch out, stretch out. I want you to say this out loud. Whole body, whole self. Whole body, whole self. Now give yourself a big hug, because it's cold in here. Well, Star, you ready to get this thing started?
Let's do this. I'm never cold. That menopause ain't playing with you, honey.
Well, first of all, I just want to say welcome to this health panel. And I will say, Star and I are on brand. We're in unity today. We've got our pink and green, our red and white, our blue and gold, our blue and white, our purple, and every other color in the room. Because we want Black women to understand this is a place of centering.
Yes.
For our whole body and our whole self. Come on, Star.
Whole body, whole self. I guess we can build on that just a little bit. Because when we say whole body, whole self, sisters, we're really not talking about a luxury. We're talking about survival.
That's right.
I'm a 15-year heart disease survivor.
Come on, clap it up. 15 years.
15 years last month.
That's right.
We're talking about access.
That's right.
I can say that because I had resources and I had insurance. We're talking about truth.
Come on.
The #1 killer of all Black women is cardiovascular disease, and it kills more Black women than all forms of cancer combined. Black women are expected to carry everything: families, communities, careers, and still find a way to be fine. And I mean fine and fine. But today we're going to shift that narrative with the help of this wonderful panel. Today we're going to tell some truths about what's actually happening in our bodies, what's happening in our minds, and what's happening with the systems that were never designed with us in the center.
Yeah.
Because when Black women are well, everything can actually change.
So let's jump into this awesome panel, because we're going to be anchoring a conversation that shapes access, environment, policy, faith, and systems. Star, let's start.
Okay, shall we introduce our panelists so that you all understand who you got?
We got some bad sisters.
We are starting with the medical truth. Dr. Nicole Butler-Muyang, also known as Dr. Nikki,
Yes.
is a board-certified OBGYN and menopause and longevity specialist, helping Black women take control of their health at every stage of life. In other words, she makes sure we understand what our bodies deserve.
Let's hear for Dr. Nikki.
Yes.
Now, you know we have the doctor in the house. We also have to bring a little faith in the house,
Yes,
too.
ma'am.
And grounding us in faith is the Reverend Kimberly L. Williams, who is the CEO of Choose Healthy Life, mobilizing Black churches nationwide as trusted spaces for health, healing, and access. So she brings wellness where our people already have trust. Let's hear it for the Reverend Kimberly Williams.
Shifting the narrative and breaking the silence, Shaquita Lockley is an award-winning filmmaker whose work is breaking the silence around fertility and reproductive health for Black women across the country. She tells the stories we were never told but needed to hear.
Come on.
All
Let's
right,
hear it
Miss
for her.
Shaquita.
And building the next generation with intention. I have next to me the one and only Sister Jacqueline Glass. She's a wellness leader and youth development strategist, creating pipelines that empower Black girls and young women and leading them to healing and thriving. Because she's raising the next generation to live whole, not to just survive. Let's hear it for Jackie Glass, y'all.
Way to go, Diane.
Close us out, Star.
And in anchoring us in policy and
Come
power,
on. Woo, 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 woo.
you all have been introduced to her before and you know her as our sister friend. Congresswoman Robin Kelly is a national leader in health equity, serving Illinois in the U.S. House of Representatives and championing policies that protect and advance the health of Black women. She's been doing this work. It's in her spirit. It's in her purpose. She turns policy into protection. Welcome, Congresswoman.
Congresswoman.
Sister. So I'm going to kick us right off. We've brought together some voices who are doing the work every single day from every angle: medicine, faith, storytelling, policy, and community. So let's ground it in truth from the beginning. I'll start with you, Robin. What is one truth about Black women's wellness that your work refuses to let the world ignore? And then we'll go down the line.
Well, I have to say, I was the person that brought maternal mortality and morbidity to Congress. I heard a story from a constituent. That's why your stories really matter. I didn't realize it was such an issue in the United States, and I heard the story, and I hit the ground running. We had a big forum in D.C., and it was packed with so many people with so many stories, and that was almost 10 years ago, and I've been working on it ever since. I was able to get Medicaid postpartum coverage from 60 days to a year, and a number of other things, but there's still so much more to be done. We talk about the average being 3 to 1.
That's
nationally, it's 6 to 1 in Illinois. So it's 3 to 1, that's the average, but depending on where you are, it's worse. You know, it's not better. Currently, I'm working on the Wells Act. That was my constituent. That was discharged from the hospital. She was there 6 hours in labor had to give her baby on the side of the road in Indiana. They didn't know what her transportation was, what her next stop was, how close the nearest hospital was. Her husband, who had no experience at all, had to deliver her baby. And so we have something we introduced called the Wells Act. And Congresswoman Yvette Clarke is one of my co-sponsors of that. But we have other bills too, as Yvette talked about, the Momnibus, we have the Care for Moms Act, a lot of different things, because this is just such a pertinent problem, and it's not getting better.
Yes, indeed. Reverend?
One truth about Black women's health. Come on, Reverend Kim.
One truth. The truth about Black women's health is that we tend to spiritualize neglect.
Yes. Why'd she bring the word all quick like that?
So,
did you write it down? Write that down. Write that down.
I love it.
So we spiritualize and normalize being tired. We spiritualize, we normalize being worn out. We carry the load, but we do not take the time to be receivers or proactive about our care. And when we go down, everything around us goes down. And that's why the work that we do is so critical, because we know that our women are the backbones of our churches, right? And so we do this work to ensure that the women in our congregations and in our communities are not being reactive to what's going on in their bodies, but they're being proactive about what's going on in our bodies. It should not be normal to wake up every morning with a headache. That's not normal. It should not be normal to have a pain somewhere and we just say, oh, she work hard, she good at what she do, she look good. She's worn out. Somebody needs to sit her down. Someone needs to say, have you gone to the doctor? But our services brings the care into the churches at no cost so that people who are afraid of the system can come into their houses of faith and receive care. So I believe we just over-spiritualize some of these conditions, and it is not of God.
Amen.
Can the church say amen?
Amen. Dr. Nikki, one truth.
So I have to agree with you, Reverend Kim. What I would say, I have so much to say on this topic. I could talk for hours. But what I really want you to know is that we need to be listened to. We deserve that.
Wow.
That's
good.
part of the issue. So I
Write that down, y'all.
Part of the medical community, so I'm not going to act like I'm not. I will say that I'm a part of the medical community, and we have earned the mistrust that you have of us.
Wow.
We have earned that.
Whoa.
We have earned that.
Ooh.
It is well deserved. We have put things in place that make it so you don't feel comfortable coming in, that you feel better going to the church, that you think it's okay to wake up every day with a headache, and you don't want to call because you feel like when you get in the office, you're not going to be listened to anyway.
Come on.
So that's a waste of your time, which we don't have anyway.
Come on.
So what I would say that I want to leave long beyond my years when I'm gone is please listen to Black women. We don't come in and say, I'm in pain. We don't want to go in anyway. We don't have time. We're taking care of the family, your mama, your daddy, your grandfather, your husband, your kids. We're taking care of all those people. We don't have time to just come and sit in a doctor's office for nothing. When we show up, give us the respect of listening to us. Don't talk down to us. We are not stupid. We raised your kids.
Well,
Nursed your kids. Did all of that. We were good enough to do all that and build this country. We are not stupid. Don't treat us as such. So we want to be heard, and the medical community needs to listen to us. Hopefully that lasts long after I am not here anymore.
Amen. Come on, sis.
I feel like this is a tag team sermon.
I love it.
A medical truth is, if we don't see it, it's not happening. If we don't see it, apparently it's not happening.
Wow.
When I started working on Eggs Over Easy, Black Women and Fertility, that's my documentary that was on the Oprah Winfrey Network. I started working on it a decade ago because we couldn't see it. And if we don't see it, we don't talk about it. Our mamas don't talk about it. Our friends don't talk about it.
Wow.
So I started working on it. One of the studies that came out, 2016, it studied all of these physicians in this country, what they thought about our pain level. And they felt like, or they had been taught to believe that Black people, particularly Black women, don't feel pain the same way other cultures feel pain, other races feel pain. So when we go in and a woman just has a baby or is pregnant and she has a headache, they give her like an ibuprofen or a pill and send her home. But if a white woman goes in, they put her in the hospital, make sure she's not having preeclampsia and doesn't stroke out. So when we say, if you don't see it, it's not happening. It's because these doctors, all of these doctors who feel like we have thicker skin and we don't need to, you don't have to listen to us when we come in. You don't have to see us when we come in. It's because they don't have friends who look like us. It's because they don't go to church with people who look like us. But when they could see us on a show like Being Mary Jane, that she's having an IVF procedure and it is painful and they're showing that, they're visually showing it. No, you don't go to church with us and we're not your homegirl. But you're watching us on television and you can see this patient who who is brown has pain like everyone else. So part of my passion and my goal in life is just to make sure that they can see us, because that's just not true. If you don't see us, it's not happening. No, you don't see us, it is happening. So the onus is on us mostly to make sure that people can see these are our stories. We're here to tell them. If you're paying attention to anything that's happening in the entertainment industry right now, what's happening with our country in terms of like silencing black women, making us be invisible, that is also happening in film and television. So many of us who are trying to tell these stories, we're getting no's from the network and no's from the streamers because they just aren't interested. And they'll say, if you have a story that's about music, we'll give you some money. If you have a story that's about an athlete, we'll give you some money. But if it's about our health and keeping us alive, there's nothing there. So that's why you have not even seen an uptick of stories about our health and what's happening with us. So that's it for me. If you don't see it, it's not happening.
That's a big one, y'all. That was
Way
big.
to go,
Come on, Jack.
Shanita.
Health is the #1 priority in this country. Chronic disease, a stat that no one has ever heard of, I'm sure, well, maybe the doctor has and a few others. 40% of African Americans will no longer be here by 2050. This is Dr. Kim Williams, who was head of the American Cardiology Association. We are disproportionately affected by chronic disease as black women: heart disease, cancer, diabetes. This is something that, if I could wave my magic wand, as Miss Bishop Leah did years ago, I would want black women to take the charge on health in our country, because we are the leaders. We are the ones that folks follow and listen to, but we have to be healthy. If I could wave my magic wand that Bishop Leah passed to me, it would be that black women would learn to take care of themselves, to put the oxygen mask on, to get the education, to know what your ABCs are, your A1C, which is your blood glucose, your B, your blood pressure, your C, your cholesterol. Not have the doctor tell you what these numbers are, but go to ChatGPT, right? And know what it means to be within normal limits. You know, that is my hope and prayer for our country, and I know that black women can lead the charge. And this panel of women, this is a very important panel. And I want to double what my sister said in terms of media, because I am also a filmmaker. My film was a spotlight film 2 years ago at the Pan-African Film Festival, Sisters Getting Well, but it wasn't taken up by media because we are not a priority, but that's okay. I'm going to the churches, a church of 10, a church of 100, a cruise ship with 4,000. We're going to talk about these issues because 1, 2, or 3 are gathered.
He's in the midst. I love it. So I want to piggyback, because I heard the list, the policy packages. Sisters, please pay attention to these. We want you to go back and advocate for these particular pieces of legislation you heard. The Omnibus Bill, we've been talking about this. You heard we spiritualize neglect. We deserve to be listened to. And if we don't see it, it doesn't happen. These are some themes that you just heard. Now, that clock is not of God. That clock is moving too fast. That is not what he said. He didn't say that. He didn't say it, did he?
He didn't say that.
Thank you, Star. So we're gonna run through a segment of these questions, but I do want to hit this bully question, Dr. Nikki, for you.
Oh, okay.
Stress,
Yes.
racism, and the political climate. Y'all heard me? Stress, racism. Let me add sexism, and this political climate. The question for you is, how do those issues show up in our bodies?
So
That was deep. Wasn't it deep?
when I got that, when you sent me that question earlier, I said, that's a big question.
It's a big one.
So stress is a killer. It is a killer.
Oof.
So racism has always existed. Sexism has always existed. This political climate We've not quite seen this level of it, but we've seen this. So those things are constant. What we have to do is learn to deal with our stress better. So I talk to my patients about longevity and doing things that decrease your stress. That, first of all, starts with prioritizing yourself, which we do not do innately. That is not something that comes naturally to us at all, but it is required. So, decreasing your stress. I am a huge advocate for my patients to exercise, to pray, meditate, take time every day, even if it means you get up a little bit earlier. You don't even have to move out of the bed, actually, to take time with God and to do your breath work and meditation. So that's very important. Sleep is hugely important, especially as we age. You have to get sleep. Now, for me, I am not a great sleeper. I feel like I am thinking
all night
in
long.
my sleep.
How many of y'all feel that too? Oh my gosh.
That is unnatural.
We're unnatural, y'all.
It's unnatural. My husband does not have that problem. He is asleep as soon as he hits the pillow. I look over there and I am like, how did he fall asleep?
Because he ain't thinking about nothing.
He ain't thinking about nothing.
He ain't thinking about nothing. My husband ain't thinking about nothing either.
1 minute, his head hits and he is snoring. And my brain is going,
Ooh,
and
so
I am
good.
thinking about all through the night, how can you get good sleep? How can your body restore itself, which is what sleep is supposed to do? We restore ourselves when we sleep, but how can it do that if your brain is constantly going? How you learn to do that is you learn to turn your brain off. It's hard to do.
How do you do that?
Right. Prayer.
Okay.
Meditation, and maybe you only learn to do it for 1 minute at a time. When I learned to meditate, I meditated in 2-minute gaps because by the 3rd minute, I'm at Target, I'm at the grocery store, I'm talking to my child or what other things I have to do.
That's helpful.
I gradually have built that up to
Very
about
helpful.
20 minutes.
Wow.
And that helps decrease stress because these other factors that we cannot control, racism, sexism, and this political climate, we cannot control that. We can control our response to that. And what that does is learning to, as my grandmother said, listen to the still small voice. But you have to get in touch with the still small voice, which means you have to quiet that mind long enough to do that. That takes you being very intentional about doing that daily, several times a day. I recommend just starting it daily and then building up the time, and then you may have
That's great.
You can do it throughout the day.
Thank you.
Reverend Kim, thank you, Dr. Nikki, first of all. But Reverend Kim, I heard Dr. Nikki say something about things that are quiet. So what are the myths or silences that still shape our health, since we're talking about what we do?
I think some of the silence is fear.
Okay.
And what we fear, we don't face. And so I think fear is one of the silent things that take us down.
Because preventive medicine will save your life.
It will. And so at Choose Healthy Life, our work was founded on Deuteronomy, the 30th chapter and the 19th verse.
Yes.
What it says is, choose life.
Choose.
So that you and your generations may live.
That's right.
The other silent thing is the choices that we make. We will choose to put something first instead of choosing to make the appointment to get the screening that provides that preventative information we need.
Yes.
At Choose Healthy Life, we have been able to test over 53,000 people and connect them to disease management care.
Wow.
But we do that through our paid health navigators. We train and pay a health navigator that is identified in our church. And here's why this is important. We are not going to talk to people we don't trust about our health.
Amen.
Amen.
And so part of our training with our health navigators, and the reason why I find them to be extra critical, if a mother comes into the church and she's trying to figure out her life, health is last on the list. And so a lot of times our work through our events, we're meeting social determinants of health. And what we do is put in place what I call a discipleship model. Sometimes when someone comes through the door of your church, the first thing they need is their needs met. They need a smile.
Wow.
They need a hug. They need a I see you
That's
moment.
good.
They need a I care for you moment. And our navigators disciple them, and after a while, once they've built this rapport, this relationship, then we say, come take this at no cost Blueprint for Wellness exam. And that Blueprint for Wellness exam defines all of your blood draw indicators. So it defines each of those metrics.
Wow.
That metric, then it prints out a booklet. Here's why this is important. How many of you have your manuals in your car manual?
Yes.
Don't nobody read it till the car break.
That's good stuff.
It's dusty than a mug in the you know it's dusty than a mug.
And so the Blueprint for Wellness provides a manual for what's going on in our bodies.
Yeah.
We've had women to take that booklet, get their physical done, and after their physical, they'll say, but my number was high, this number was high. Listen, what you said. The doctor will say, well, where did you get that from?
Wow.
Well, why didn't you tell me my number was high?
That's the question. That's the question.
And this number impacts this in my body. And so the important thing here is not just the prevention, and this is why I love our health navigators. It's the education, it's the knowing, it's the I won't be silenced until you hear me.
Yeah.
I will, if you're not the right doctor, I'm gonna keep knocking on doctors' doors till someone hears that I need the care that I need. And so this model that we have, the preventative care, also helps to reduce medical debt. If you're going to the emergency room every time something hurts, that's the wrong model.
That's good. That's very
Preventative
helpful.
care, the work that we're doing says we've got to connect you to a primary health care provider, someone that's going to be able to walk with you through your health journey and give you those answers that you need for what's going on in your body. So preventative care should be our step one. You got to know what's happening in your body, and only you know your body. So if that thing hurts, stop denying it.
That's the real push here. And then start with, we've been talking about this. I love y'all taking these nuggets now. We're getting them, and this clock keeps running, so I'm trying to stop the clock. It won't stop. Let's switch over to storytelling.
Yes, to hear you say preventative care, I'm alive for that reason.
Come on, tell the story.
I had preventive open heart surgery. It sounds crazy, but I got to plan it. I picked the doctor, picked the time so that I could recover from it. Very few people get to do preventive open heart surgery. It usually happens after a heart incident.
That's right.
And preventive care is the difference between living and dying, plain and simple.
Yeah.
That's a story, and that's what Shaquita, you, Jackie have been really working towards,
Yes.
is bringing these kinds of stories
Yes.
as living examples. What we are taught is what we see, as you so eloquently pointed out. So let's move a little bit to culture, storytelling, and visibility, since that's the expertise that we have on this panel also. I'll start. I'm going to start with Jacqueline. What does it look like to build a wellness pipeline for Black girls? Because that's the next generation
That's right.
of where we should be looking.
So in 2010, I started an organization called At the Well Conferences. It started as doing conferences for teen girls. And the backstory, how it was birthed, I worked in New York City as a court reporter. I'm retired now about 7 years. But I worked at the job. I put in for a supervisory position, and I was denied not once, not twice, not 3 times, not 4 times, but 5 times in 3 different counties.
Wow.
So instead of going into depression and woe is me and it's not fair, I went to the Lord, and the Lord gave me At the Well conferences to prepare the next generation of young girls so that they would not have to face rejection, being overqualified, having a master's degree, but the person with the high school GED who was not the same melanin got the job. So we started At the Well conferences. We would bus 200 to 300 girls from Bronx County, Manhattan, to Princeton University and hold one-day empowerment conferences. So that grew to hosting the 2-week academies, which would teach leadership development, would teach self-awareness, would just teach things that girls needed. We started around the same time as Black Girls Rock. So this was a labor of love that everyone brought into. When you bring an idea to someone with enthusiasm, folks are going to catch on. And there are clergy and ministers and folks in this room that have come to speak to the girls, as well as celebrities like Danny Glover, who's come to speak to the girls and the boys, Nicole Ari Parker, Bishop Leah Doutry was one of our speakers. We've had so many speakers throughout the years. So building a pipeline is allowing the girls to be who they are. We have to meet them where they are, encourage them. We have to, sexism always comes into play, but girls are special. They need encouragement. They need to know that they are special, created in the image and the likeness of God. We got to make a big deal about them, not just go to the football games, but we need to go to the cheerleading games or the gymnastic games or wherever. We have to support our girls. I have a heart for those girls that are really quiet, those introverted girls. And when they come to the program and they come out and you can't stop them talking, I know that I've done my job.
You got them.
So this question of creating pipelines, I don't have all the answers to this question because we lost our funding and we are not having a program this year. But it's all right, the baton is going to be passed. It's going to be passed to those girls that I'm meeting with who are now 31 years old and 32 years old because they have to carry on the mission as I segue to health and wellness. So to answer your question, that pipeline, it's done in the community. It's done with each other. We are our sister's keeper. And we have to ask for help. As Black women, sometimes we want to always do it ourselves.
Right.
But we have to ask for help because we need each other.
Yeah.
And these young girls need us. They are our future.
Jacqueline, I just wanted to say, in this room are people who work in the grant area. So you all have now heard that there is a funding need to continue this work.
That's
so when
right.
you hear about access to funds from organizations that want to be in the business of health, think of what you're hearing where we actually need in our communities. And Jacqueline's program is one that will benefit the next generation. So that's something that is worth funding and worth our advocacy for that funding. So Jacqueline, I just wanted to share that as encouragement. Thank you very much.
I want to talk about eggs over easy.
Yes, indeed.
As someone who struggled with I lost 3 children through miscarriage, and blessed to have one. Amen. We shout out to Micah. And it is a blessing to talk about this conversation because I really want to ask you about the film and this kind of generational disconnect on infertility. I want to ask a hard question. How many of you have ever experienced miscarriage? Yeah, thank you for sharing.
Yeah.
Safe space, right? We need these moments And you actually did a full film to talk about IVF, talk about the experience. We're going to talk about expense in a second. We're going to talk about cost and coverage and what that means. But what did you learn in the journey, in the film? Give us a short synopsis, because this clock keeps telling me we got these minutes, and
Right.
I'm ignoring it.
Yeah.
Eggs over easy. Talk about it and tell us, what didn't Mama and Auntie tell us when it comes to infertility?
Yeah, thank you for that. And for every woman who feels safe enough to even have this conversation.
Thank you.
So I was 40, about to turn 41. At my OBGYN, I never miss an appointment, never miss. And she looked at my chart. She says, Miss Lockley, you have a birthday coming up. Your eggs are turning 41. What do you want to do with them? Being the type A personality that I am, I plan everything. I schedule everything. I didn't have an answer for that because nobody ever asked me that. My mama never asked me that. They might say, well, when are you getting married? But nobody had that conversation.
That's the black question. When you get
exactly.
married.
Add to that, I had fibroids. So this threw another wrench in the plan, because now it's an emergency that I walked in not knowing I had an emergency with my eggs and some fibroids. So I started doing research.
Wow.
I am a producer by degree. I have a master's in film. I produce films. I never set out to direct. But I thought, first of all, I was angry. I was enraged. I've been going to my wonderful black woman doctor. She is incredible. It's not her, it's the system. But I've been going there forever, and nobody ever asked me these questions.
Yeah.
And so I was ticked off, to say it nicely, since our president in the room.
Amen.
I was very upset about that. So I said I would do a 15-minute short film just to make sure the girls I mentor, I graduated from Spelman, so that the young girls, but hey, Spelman, so that all of the young girls coming behind me, nobody would get to 41 and have this question asked of them. And once I said it to one person, the floodgates opened. Everybody started saying, well, what about my cousin and what about this? So what I did is I started at home with my mama and her sisters. My mother and all of her sisters had hysterectomies. But I knew they had a woman procedure, a feminine procedure.
A feminine procedure.
Because that's what we called it.
That's
so
right.
So when I started doing all of my interviews, because I was paying for everything out of pocket at the time. So when I started doing these interviews, they would talk to me, but they wouldn't talk to me on camera. My mother, her friends, anybody, like the women, my mentors, anybody in my life who now they're like 70. So like the 65 and up crew, this generation of boomers, they would talk to me, but not on camera because it's private and we don't have these conversations. To the point that one, if they had miscarriages, your mother could have had 5 miscarriages and you would be struggling at the doctor. You didn't tell your mother, and your mother did not tell you this is in your family. Maybe you should start at 25 or 30, going to the doctor, asking specific questions.
That's right.
So that's what I started finding. But the people who were my age, I'm Gen X, so my peers, they would talk about it, but it was kind of reluctant because our terminology, instead of saying, I need an open myomectomy, which is a C-section, but instead of taking out a baby, they take out all your fibroids. So instead of naming the thing a thing, it was this feminine procedure. So that was kind of the bane of my existence in trying to get the film made. And part of the goal, even in doing the film, is to make sure the next generation, they don't have these roadblocks. When I look at my mother's generation, I don't look at them with anger or anything like that. They did what they could do, what they knew to do. That's what their mothers told or did not tell them. That's what their aunts told or probably did not tell them. So they were repeating that cycle. So when it came to us, we didn't know anything because they didn't tell us anything.
Wow.
And what I've noticed now with the next generation, over the past decade, but specifically these past 2 to 3 years, because we're forcing people to look at us, forcing you to like pay attention to what's happening with our bodies. These new girls coming up, they're a different breed. And I was telling Christy.
Come on, Gen Zs and millennials. Shout out to the Gen Zs and millennials.
This lets me know
You're like,
that,
yes.
Yes, I see some of you. This lets me know that we are cracking, like making some progress. We pulled up seats at the table and they're actually sitting down. I'm so happy about it. But I was sharing with Christy, I follow a lot of young people, particularly the new Spelman students who are coming out. And one of them posted like this TikTok video a couple weeks ago where she removed the IUD and was excited about it. She had dealt with depression, the IUD. Once she removed it, she had no more depression. The acne left, like this whole video. And at first, I was appalled because I am 51, and I couldn't believe you talking about an IUD on Instagram. And then I read the comments, and she had 200 comments of young people like, oh my God, yes, is this what's wrong? Let me go to my doctor. So her following of people, just
That's
because
influence.
she shared her TikTok
That's
dance video,
influence.
like, hey, I took out my IUD. So I went from being appalled to applauding her because I could see in real time that the conversations that we would never have,
You saying something.
they are now having it. So that has been like the blessing of eggs over easy is that, yeah, I did an HBCU tour. So to your point, once the doors started closing everywhere and funding started drying up, especially with this administration, I called my friends, can you give me $500? We need to go to whatever college and let these students see the film.
Yeah.
So I did an HBCU tour, and that's how I follow all these students who came to the tour. So to watch it in real time, they would watch this documentary, they would get words because you can't ask questions if you don't like know the questions. So they would say, okay, now maybe this is a fibroid. What is endometriosis? They had like definitions and some terminology, some words to ask their doctors questions instead of just saying I ache. Well, what is it? Is it a pain or is it like
you were getting more
real time
in real time responses.
Yes.
And I gotta slow you down because I only got 10 minutes. But I want to say one thing. One of our sponsors is here to talk about some of these issues, and it's the Cost and Coverage Collaborative. And let me tell you why we are stopping to talk about this, because you just said exactly what we want people to hear. Is that the experiences of many black women to be able to interface with IVF or any kind of procedures, the costs that are associated with our health care are unprecedented. Star's going to share a personal story, but I want to shout out the Cost and Coverage Collaborative, one, for being a sponsor of Power Rising. That's number one. But there is a new campaign, hear me now, it's called One Nation Overcharged. I'm gonna say it again. One Nation Overcharged. So the NAACP, NCNW, I see our chair of the board is here. Lois, keep raise your hand. NCNW is gonna be doing this work. We're gonna be traveling the country to talk about cost and coverage. Now, Corey and Brenner are here. We have QR codes, my sisters. We want you to tell your story of how costs of healthcare may have really affected your experience. I heard about IVF. We've heard about challenges with cardiovascular disease. But we have to tell our stories so that we can change these systems. I'm going to say that again. If we don't tell our stories, our lawmakers won't know how to help us change these systems. And so this is a collaborative effort. So Star, let's talk about the policy.
Right.
And then I want you to tell your story because I want people to understand that this is a relevant moment with our 9 minutes and 7 seconds left.
It never ceases to amaze me how things can change overnight. I've been personally waiting to hear from my hospital system, Mount Sinai, who decided that they were not going to accept Anthem Blue Cross Blue Shield. And Blue Cross Blue Shield is in negotiations with Mount Sinai, which is one of the biggest health systems.
Wow.
So everybody that's on television or in movies is a member of the Screen Actors Guild. That is our insurance.
Wow.
So that impacts on every single person that I know that works in the media industry on whether or not you have access to a major hospital system. Well, that's where I had my open heart surgery. So was I supposed to change cardiologists in the middle of being a survivor? Wow. Am I not allowed to get my echocardiograms, transesophageal echocardiogram, EKGs? Wow. And if I do, am I going to be responsible for that $25,000 a year copay? Because that's what it costs.
She said $25,000 a year.
Yeah.
Copay.
And while we were here in this past week, I just got the notification that Sinai and Blue Cross Blue Shield came to an agreement.
Wow.
But to relieve that pressure of what I know we have to do every single year, it translates down to every single woman who doesn't have access. The difference between living and dying in America, and I'll just say this, can be your zip code. The people in one ward in New Orleans
Come on.
die at a much faster pace
And higher rate.
and a higher rate than the people who live in the next zip code over.
That's right.
That is a study that was conducted by the Robert S. Wood Johnson Foundation. So I got the numbers, and it scared me that access and resources is the difference between living and dying, which is the perfect transition to go to policy.
That's right.
Because, Robin, you know this better than anybody. If the policies and the systems don't change, we die.
First of all, the bottom line is, in the richest country in the history of the world, we need universal health care.
That's right.
There it is.
That's right.
Then when we have that, we need lower prescription cost. And we also need access, because my district is urban, suburban, and rural. I start on the south side of Chicago. I go south to Danville, west to Pontiac. I have 4,500 farms in my district. I have hospitals that are closing maternal care in Chicago, in the suburbs, and forget in the rural areas. I had a farmer who had to drive 60 miles for his wife to deliver a baby. She wasn't quite ready. They sent him back home 60 miles. He told me he went into the field for 20 minutes. She was ready, and
Yeah.
he drove back. So 180 miles, and his wife finally had the baby. But that's
Crazy.
the bottom line. You know, I lost my husband a couple of years ago, and he got sick when we were celebrating our 20th wedding anniversary. We were second marriages in Montreal. He got sick there. He went into the hospital, stayed there for 3 days in the emergency room.
Wow.
And we could talk about Canadian medicine if we want to. His bill was only $800.
Oh, my
That would
goodness.
never happen for a half hour, probably at the hospital.
A hospital
here.
Costs
is-
more than the $800.
Yeah,
to open the door.
$800 for 3 days
That's
in the emergency room, and they got him back together and all of that. But unfortunately, he came back here and he didn't make it the next week. But
That's right.
he got really good service there. So
Wow.
if they can do it around the world, and again, we're the richest country in the history of the world. So universal health care, we have to have access. A lot of us live closer to McDonald's than we live to fresh food. That's the other thing. We have to think about food as
Come on.
medicine also. And we actually have legislation around that. The other thing I want people to think about is clinical trials. We are not in enough clinical trials. Black people, period. People of color, period.
Yeah.
But we're talking about women. So we are not in clinical trials. And so when medicines come out and cures come out, oftentimes they don't fit us, but we have to go into these clinical trials. And as my colleague said, we have to make sure NIH is funded, CDC is funded, and we have to make sure the data is collected in the same way. When COVID happened, each state had different ways they did the technology and data collection. Some states, it didn't even match with their technology. They didn't have the latest technology, so we need a lot of improvement there. And we have the money. If the man is spending billions on this war.
Come on.
Not to get political, but on this war in
And a
Iran.
ballroom.
And he wants 200 billion more, but people are hungry. They can't take care of their health. They don't have a roof over their head. Our education system needs improved. There's so many things that we need to do here. And just lastly, I'll end it with, when we do, I'm a Democrat, so when we do take back over, we can't go back to business as usual.
Well.
Because things weren't okay, even when they were better, but they weren't okay for many people when we were in charge. And I'm going from soup to nuts, immigration,
That's
healthcare,
good.
education, crime, on and on and on. We have to do better.
So let's do the lightning round. You want to close up
Yes.
with the lightning round?
You
All right,
started, Shavon.
We got 30 seconds for each of you. You ready? Here's your lightning round. We need one action for these sisters in the room to take in the next 30 days to move toward, what's our theme? Whole body, whole self. All right, Jackie, you're going to start us off. 30 seconds. One action every sister has to take in the next 30 days to move towards whole body, whole self, and we'll go down the line to the Congresswoman, and then we'll close out.
Prioritize yourself. Know that the care that you give to others in your family, in your community, in your church, redirect that and give that care to yourself.
Yes.
Make yourself the priority. Make yourself, you know, if you don't have a date to go out to dancing, dance in the mirror. Get your movement in. Do your steps. Do some line dancing. Just know that you are the most important person. I love women. I love women, but there's something about women over 50. We go to these churches, we show the film, we have these conversations, we make these relationships, we make you feel special because you are so special.
Yes.
So just know that you are worth it.
You are worth it. Let's hear it for Sister Jackie, y'all. Come on. Come on, Sora.
Within the next 30 days?
Next 30 days.
Okay, when you go home, ask your flower garden, the people who are placed in your life, ask all of them if they've made an appointment to see their gynecologist.
Ooh.
You will be surprised at the no's. 12 months. Ask them within a year, have they gone and get the pap smear? And many of them are going to tell you no, and then encourage them to do that.
I'm just here for the flower garden. Come on. Yes.
Chiquita,
Come on, let's
just
hear it
so
for her.
you
Let's
know,
hear it
you
for
just
Dr.
saved people's lives.
You really
with
did.
just that one question.
That was huge.
You just saved people's
Let's hear it
lives.
for her, y'all. That was good. That was excellent.
That's good.
Come on, Dr. Nikki. She stole your thunder, but steal it back.
I'm a gynecologist, so obviously I'm going to say go get your pap smear.
Yes.
That was my thing. But what I will say to you is make the appointment.
Ah.
Period.
Come
Make
on.
the appointment, and then just like a flower garden, I tell my patients at 40, you need to build your team of doctors. Otherwise,
Ooh,
when
yes.
you show up to the hospital, you
Come
belong
on.
to whoever is on.
Okay.
So start to build
I
your
love that.
team, make the appointment within 30 days, and then take the next 6 months. It may take that long to build your team. You need an internist, you need a dentist, you need a
Come on.
gynecologist, you need a cardiologist. These are the people that you need in
Can you
your
say that? I know you're writing it down. I saw y'all. Right. Say it
so
again, Doc.
you need
Who
a
do we need?
gynecologist, an internal medicine doctor, you need a dentist, you need a cardiologist. These are the things you absolutely need. Make one of those appointments now. I like the gynecologist, of course, but you can start with the internal medicine doctor. They can start you making your flower garden. You need to belong to someone, and you need a
That's
group
good.
that you are the center of that group.
Oh,
so
yes.
make
We
the
like it.
appointment.
I love that. Thanks. Come on. Dr. Nikki just gave us a list.
For
Come on.
real.
Come on, Reverend.
So first, I need to acknowledge my founder, Deborah Fraser House. Would you please raise your hand? She's the
Hey.
founder of Choose Healthy Life and our board chair. I would simply say choose life.
All right.
Choose life in what you pray. Choose life in what you schedule.
Come on.
Choose life and stop ignoring what you've been putting off. And choose to model life so that you and your generations may live.
Choose life. Let's hear it for Reverend Kim, y'all. Come on, Congresswoman.
I agree with everything that's been said, but I'm going to be a selfish public servant. Please don't get weary. Don't get lost in the chaos. We need you. We need you to be a voice. We need you to call your rep on every level of government, because that's the only way we can make changes. Your voice really does matter. You just need to believe that, and we desperately need you to vote. We just had voting, I know well, in Illinois, 20% of people voted.
Come
That's
on.
not going to get the job done. You need to get the right people in office and keep the right people in.
That's right.
The people that aren't doing what you want to do, take them out. Thanks.
Go ahead. I saw you, Kim.
I love this.
I just have one more thing to say.
Absolutely.
If you are in Atlanta, Detroit, Washington, D.C., New York, or New Jersey, and you do not have health care, you can go to www.choosehealthylife.org. We give our at-no-cost blood screenings in our churches. And all you need is your name, your number, and email address, and you will be screened. So if you're in any of those locations,
That's excellent.
I want to make this resource available because you don't have to pay for it. You don't need insurance. You need nothing. If you're in those cities, please, please take advantage of those
Great
resources.
resource.
That's great resource.
resource.
What's yours, Star? What's your closeout?
I actually was saying, I don't want to be pessimistic, but I want to tell you all, don't leave here inspired but unchanged.
Come on.
Because you can get all the inspiration you want, because Power Rising, that's what we do. But now you got to be activated. And for our health, that should be our most active state.
Yeah.
Is for our own health. We advocate for ourselves. We will be writhing on the floor in pain, but won't call emergency to come and get us because the kitchen ain't clean, okay?
Amen.
We have to put ourselves as a priority, okay?
You better preach.
You don't want nobody coming in your house and seeing that you got dishes in the sink, okay?
And your chest is tight.
And your chest is tight, all right? We're not having that.
Yeah.
The dishes will get done.
Amen.
Okay? Buy paper plates. Whatever. Take care of yourself. Don't leave here inspired but unchanged.
Give it up for Star, y'all. Listen, we're closing out. In the next 30 seconds, I want to make sure that you get those QR codes and tell your stories. But I want to say this. Our excellence is now exposing their mediocrity. Our excellence is exposing their mediocrity.
Yes, yes.
And because your health care has to matter to you, if you're not well, you can't be excellent. You can't serve sick. You can't lead sick. And I will tell you, there is a massive amount of things going on in Congress, in healthcare. They did not want to extend the tax credits because your excellence is a problem. And I'm saying to you, my sisters, we need you alive. We can't win elections if you're not alive. We can't vote if you're not alive, if you're not well. And please, to the seasoned women in the room, don't stop sharing your stories. We need to know your truths so that we can save the next generation. We love y'all, Power Rising. Whole self.
Whole health.
Whole health.
Thank y'all. Give
Thank
it up.
y'all.
for
Thank
them.
y'all
Give
very,
it up.
very
Give it up.
much.
Give it up. Give it up. Give it up.